Well, is the American economy on its way to recovery? Numbers suggest growth, but another sign may be more telling than you think. Joining us this morning is cosmetic plastic surgeon Jennifer Walden. And Jennifer, I want to throw out all the numbers, the GDP, the market. You may have more insight than our local economists, maybe.
Right. Well, in the past year, cosmetic procedures have risen 5%. And I believe this shows a sign of economic recovery just because it's a marker of disposable income for people.
Absolutely. And when did you see that drop off as far as the business goes? Because I'm sure with the recession, it came across that way as well.
Right. Well, I recently relocated from Manhattan, where Wall Street was just blocks away, but the drop-off really for all parts of the country was in 2009 and 2010.
And I know that you can kind of gauge, numbers came out, 1.5 million surgeries, plastic surgery-wise, in 2011. And while that is an increase, still well below some past years, several years ago.
Right. It really spiked in 2005, but we are seeing a steady incline of procedures, and especially minimally invasive procedures, which cost less money, are considered maintenance, but people really feel like they can afford those and are getting those on the way to the bigger cosmetic plastic surgeries like facelift, eyelid lift, breast augmentation.
Easy in, easy out. What are some of those, typical, you said minimally invasive options?
Typical options are Botox, which is, extremely popular. Over 5 million people every year get that. Hyaluronic acid fillers like Juvederm and Restylane, laser procedures for resurfacing and hair removal, microdermabrasion, for example.
And I come in, I get that. How quickly can I be back doing, back on the job? How long does it take, recovery-wise?
You can come in the office, get that done, and go back to the job. Well, you're a news anchor, so you may take a couple days off if you have any bruising or swelling, but typically you can go back that day to work.
So relatively quick. And as far as the trend you're seeing, hopefully continuing to go up, what are you feeling right now?
Well, from speaking with colleagues both in New York and in Austin, Texas, it's a robust cosmetic surgery market, so I anticipate that will go back up to probably around what it was in 2005.
All right, and we will certainly hope that as well as a mirror of the economy. Thanks so much for being here today.
Thank you very much.